the audience. We have still the head count is still more than 100 people. It's amazing to see all of you persistent when it comes to desire to keep learning. So next up, we have an amazing segment conducted by an amazing uh, renowned clinical psychologist, Mr. Abhishek, who will be highlighting to you all through an amazing presentation the tricks when it comes to managing stress and anxiety. So the podium is all yours, Mr. Abhishek. You can first of all introduce yourself and then take it from there.
Yes. So, good afternoon, all the medical professionals or about to be budding medical professionals, I would say. So, a very warm welcome to all the doctors. Where I extend my great respect to all my fellow speakers and the conveners of this webinar. And I think I've got one of the most difficult jobs here to tell you how to manage stress, how to manage the stress that you're experiencing as doctors. Although most of the points have been covered by my fellow speakers, and I don't think I can do it any better than what they have. But I would still like to jut in with my own methods. So I heard that there are a few points that came up, like doing meditations, time management, right? So here in this section, we'll talk about how to do all of it. So as medical professionals, uh, yes, people rely on us, right? People rely on us desperately for saving their lives, for making their lives better, for managing their well-being. And but how do we do it for our own selves? So a quick review of what we've already discussed. So what are the primary stressors? I would like all the audience to be participative, and how you will be participative is by a show of thumbs. Okay, all of you can put that emoticon on. Okay, so how many of you feel that there is a lot of mental workload? Okay, yes. How many of you feel that there's a lot of academic pressure in terms of mental workload, examination, and preparation? And by virtue of humans, by being humans, is that we have certain degrees of competition running in our head almost all the time, right? I see many thumbs up, right? That's a great response, Shabir, right? Yes. So, how many of you? I will not ask this question again, but yes, all of us do go through personal and personal and social stresses like financial concerns. Like many of the medical students, they take up loans, they take up educational loans to pursue their career in the healthcare setup. Then, despite that, there might be some difficulties in work-life balance because all of us are adults now in some ways. We have our own needs, we have our own perspectives towards life, and we can't say that we are still finding ourselves because our trajectory is almost decided. And then, as we've already discussed throughout the session, a lack of support system. It becomes one of the biggest barriers because even though we have peers, all of us are just so concerned almost all the time with our patients, with our studies, that we can hardly be present for each other. And finally, coming to the emotional and psychological factors, which are mental health issues, which Dr. Afra already discussed, which was already covered by Dr. Abdullah, if I'm pronouncing that, I'm sorry if I'm pronouncing it wrong. And Dr. Khatia also discussed these certain points. One of the biggest concerns that was raised in the recent questions was that by Sunita, right? She said that you're always so concerned, you're always so attached to the patient that it's difficult to detach. I think one of the biggest gifts and one of the biggest contributions we can do to our field is being detached. Because if we get too involved emotionally, it's the cognition that takes a toll. And it, as doctors, as medical professionals, it becomes imperative to focus on the objective reality because it is the health of the patient that we are dealing with. And finally, future uncertainty, not only of the patients, but also ourselves. Coming back to my point, how many of us like rainbows? Again, I said you have to be participative. Show of hands. So, as doctors, we are generally used to seeing white and green, right? sometimes red, which becomes a little gross. But yeah, so we have to deal with life and we have to make it colorful. And that is why all these management techniques, I have personally uh, cumulative them into this vibrant colors of VIBGYOR. So it's an acronym that you'll be able to remember for your own self. Are you excited about it? I am a little. Okay, so we'll start with exploring VIBGYOR. Start with Violet. Yes. So what does V stand for? We'll take all the questions at the end. Just keep your notes ready. So V stands for being vigilant. Okay. So being vigilant about early signs of stress and its consequences. So I see a lot of us are uh, here who would like to indulge in skincare activities. Skincare. Even as a man, I do skincare, right? And when I'm stressed, I notice myself that I'm not doing skincare for few days. So after a week, I realized that I'm not doing my night face wash. I'm not applying serums on my face, which I generally used to. That itself is an indication that I might be undergoing some stress. So any deviance in your own behavior is an indication that we might be vulnerable to stress. And then what follows is dysfunction. So these are typically the 4 Ds of disorder that we talk in psychology and psychiatry to some extent. So dysfunction. So once we see that there is certain behavior which is deviant, which is not ourselves, which is not something that we do in our routine, that is what we identify as deviant. So we have to identify any kind of stressor right when there is any deviance in our own behavior. Basic things like skipping meals, not doing your skincare routine, maybe not listening to songs on your way to the hospital. Basic things. And then simultaneously and slowly, gradually, dysfunction steps in. We see that our productivity is reducing. We see that our sleep quality is reducing over a period of time. And that is when we start getting distressed. And this distress, we keep on feeling sad. We generally try to isolate ourselves, even though we are actively seeking. We try to seek social support. We are not actually engaging with them. We sit with people, but we hardly talk. So this is what happens. So, and then finally, what it leads to is danger. So danger can start from substance use to more severe forms of danger, maybe suicidal ideations, as we talked about in the beginning of the session. So this is where we have to identify all the signs of stresses and their consequences. Another thing that you have to be vigilant about, burnout. Yes, we have been talking about it. And then being overly attached to the patients, that is also one form. But what we less talk about is this compassion fatigue. When you start treating patients just as people, when you start treating disorders, when you start treating diseases and not the person. As medical professionals, as a mental health professional, I can say that when I'm treating a person, I'm not only treating the disorder, not only trying to cure the problem, but I'm treating the person. So ensuring their well-being is my priority. Similarly, for health professionals, it becomes important that certain degrees of compassion is required, that certain levels of empathy is required. Now, empathy is in three forms. It is at cognitive level, it is at emotional level, and it is at behavioral level. So when we are talking about this, maybe at emotional level, empathy may not be required that much. Why? Because when you get emotionally involved with your patients, when you start talking to them a lot with respect to these emotions, it might become a little problematic. Why? Because the time may increase. Because as it is throughout the world, doctor is to patient ratio is still disrupted. At least in India, it's 10,000 patients approximately to one doctor. So for this, cognitive empathy and behavioral empathy is certainly required, especially when making hard choices, when you're dealing at oncology departments, in neurology departments, uh, especially in these departments, that certain degree of empathy is required, but again, at cognitive and behavioral level. What else do you need to be vigilant about? So when we are talking about vigilant, it is all about observing your own self. Reduce vitality of the body. So skipping meals, not working out, not doing, not being able to relax, all of this is going to take a toll on your body. So over a period of time, let's say throughout a week, through maybe over 2 weeks or 3 weeks, we may think that, you know what, I'm doing a great job pulling all-nighters, studying, etc., etc. But again, at the end of the day, it will reduce my productivity. So we have to keep a check on that. And then finally, what we have to be vigilant about is feedback from others. So if a person looks at me and says me, Abhishek, you know what, you look tired today, something happened, I will take it as a sign that something might be up with me. Very casually, these colleagues, nurses, or maybe some of your regular patients may say that, sir, you look off today. So if that is the case, it is definitely a sign that we have to identify. Which brings us to the next point is, right? So medical professionals, doctors, and almost all organisms alive, we are conscious beings, right? Show of hands, thumbs. I was a professor by profession, so I want everyone to be active in the class. Yeah. So let's do a small activity. How about that? Okay. You can keep your videos off. It's a small 2-minute activity. How about all of you close your eyes? Close your eyes and relax. Close your eyes. Take a deep breath. I want you to be aware of your breath. Breathe in and relax. Now, I want you to imagine that you're in a room. In that room, there is a table. On that table is a red tablecloth. On that table is a white plate. In that white plate, there is a bright yellow lemon. Beside that plate is a knife. I want you to pick up that knife and cut the lemon into half. As you're cutting the lemon, you can feel the juice dripping down to your fingers. You can smell the fruitiness, the citrusness of the lemon. Now pick up that lemon, bring it close to your mouth. As it is close to your mouth, you can smell the citrusness, the sourness of the lemon. And now take a bite. Yes, I think now all of us can come back. How many of you could feel something in your mouth? If not complete salivation, at least something, right? See, so quite a many responses. So within 1 minute, we could trigger a biological, a physiological response from the body just by thinking. What you think is going to affect your body. And this is how mind and body are connected. This is the philosophy of mind-body dualism, which Rene Descartes proposed. He pioneered it, but it is a very, very strong reality of life that all of us live by. And this is what is also meant by interoception. How do we measure our heartbeat? Using a stethoscope or by checking our pulse, right? Now, how many of us can count our heartbeat without using any instruments or without touching our pulse? So this is an exercise that you can use to connect with your body, to relax your mind, and to reintegrate this disruption which is caused due to the hurly-burly of life. General life is so hectic and so cumbersome. And I can only imagine how difficult it would be for medical students who have to balance patients, their own academic endeavors, as well as their own personal lives. So, how to meditate? I'll give you a very easy tip how to meditate. Just close your eyes and without touching your pulse, try to count your own heartbeat. Be aware, close your eyes, just be aware of your breath. Be aware of the temperature of your breath. Be aware of the difference of the breath, difference in terms of temperature. The air that we inhale is slightly cool, the air which we exhale is slightly warm. Just be aware of that difference. You don't even need to sit in a place for 15 minutes, 20 minutes. 5 minutes, good enough. Maybe before starting your clinic, before starting your rotations, sit there, take 5 minutes for yourself. This way, you will be able to treat your patients better. Your vitality will also determine your performance, and that is what is going to make a difference. Why? Because if you don't take rest, your body will take it for you. And this is why all these issues of insomnia, of not being able to sleep properly, constant lethargy and fatigue, they step into our lives. So, in order to manage them better, it is important that we integrate with our body again. Which brings us to the point B, the blue color of our light, which is building. It's about barricading the resistance and misguided attempts to cope. Now, here we also have to identify what are our individual resistance. How many of us use our phones before sleeping as a ritual? Before going to sleep, I'm going to watch 10 minutes of Netflix or maybe 10 minutes of Instagram, etc. Quite a few of us, right? What are we doing when we are using? When we sleep, that is the time when everything that we have done throughout our day consolidates. Sleeping, having a proper rest, properly sleeping is required for proper memory, for having a good long-term memory, because that is when all the memories, all the information gets registered in the form of traces. In the neurology term, we call it engrams. These are different connections of the neurons, right? So while just before sleeping, when you're feeding yourself with all these information from, let's say, social media, what are you feeding yourself? You're feeding yourself with upward and downward comparison. More stress adding onto your life. Maybe some friend from some other branch going for a vacation, and you're thinking that, oh God, I'm still stuck here. Other professions, probably people in other disciplines, they've started making money, and I'm still studying. That's not a right comparison to make, right? Something that I would be discussing in terms of balance, but I would like to mention it here is that the profession that you guys are in, it's one of the most, probably the most noble profession in the world, where you're dealing and saving lives. People rely on us. And we don't need this upward and downward comparison when it comes to our competence. And this is where we have to tweak our attitude towards our own selves. Tweaking our attitude towards our own selves, towards our own profession, is really, really important. And only when we bring attitude changes in our lives, that is when our lifestyle will change. Lifestyle changes like maintaining a sleep hygiene, avoiding excessive consumption of substances, engaging in fruitful, meaningful social interactions. These are the true changes that will help us cope with the situation better. And so what it means by making healthier choices. So I can sit with my colleagues and talk all throughout day about patients. But am I giving myself that space to relax? So even when I'm sitting at lunch with my colleagues, I'm still talking about patients, still talking about other things. Does not make sense. When you're at work, you be at work. When you're off work, be off work. And again, I understand that it might be difficult, that you might get emergency calls, but at least till you get that. Maybe you can relax. You can stop thinking about work. If you can't stop, at least stop talking about work. As a psychologist, if I go back to my parents, to my siblings, and keep telling them about my clients, the next time I call them, they're going to be like, "Oh, how is your client doing? What did your client do today?" And etc. etc. And I would still be at work because there are these people asking me the same question again and again. So my social support should be my social support and not someone who reminds me of the cumbersome activities that I'm doing throughout the day. So this compartmentalization in life is really, really important. It does not mean that you're being complete detached from your patients. It does not mean that you're not sharing with your loved ones. It's all compartmentalization on a need to know basis. Something called good enough sharing. Not too much, not too less, but a good enough sharing. And finally, talking about arousal and activation. We want to be active throughout the day. We don't want to be aroused. Because the sympathetic system, it's designed for flight or fight. As doctors, we don't want either of them. We want to be active all the time so that we can make wise, informed judgments about our clients, about our patients. So it is important to maintain a proper, again, as I said, good enough arousal state of the body so that we can stay active when it's required. Which brings us to the next point of G, the green color. Talking about getting your goals straight and building resources. It's about choosing what is right for you. In every person's life, there's a point in time where you have to choose what is good for you over what you want. So it's like investing in different stocks. Again, I'm sorry, we are talking to medical professionals. I'm a psychologist and I'm bringing in economics, but yeah, that makes sense, right? So when you invest in stocks, there are certain stocks in which you invest for a short period of time, and then there are certain stocks which you invest in equity for longer period of times. So considering your training is going to be prolonged, why? Because you are dealing with more critical situations of the society. You're dealing with acute problems like cold, cough, influenza to more severe problems like chronic issues. Obviously, it will take time. It will take time to gain certain degrees of expertise, and that is how you have to allocate, that is where you have to build your academic resource. Talk to your professors. As Dr. Khatia also mentioned, you have to talk to your mentors in how to do things better. Every one of us is different. Some people are night owls, they like to read at night. Some people are day morning worms, they wriggle out in the day, they start digging into their books and they start making notes. So every one of us is going to be different, and not, even if we talk to people, maybe their methods will not work for us, but at least we know what are the different alternatives available to us. So having that prospective alternative is also important. In one of my cognitive psychology books, there was a very beautiful example that what is an analogy thinking. So they said that if a person wants to operate a surgery using lasers into a person's stomach, but if the laser is too high, the intensity of the laser is too high, it would damage the other organs as well. How would you deal with this situation? So they said it's like a castle. So there are different gates. You cannot push in the whole army through one gate. So what do? You enter the castle through different gates. And this is the same analogy that the doctor used to treat that particular malignancy by inserting a little lesser amount intensity of the laser from different directions to a particular point where that malignancy could be burnt and could be cured, treated. Similarly, in our lives, we also have to have these three different resources. Our personal resources, like, first of all, definitely you have to be vigilant about the differences and the deviances that you're going through. But again, having some hobby, something that you can pursue for your own self. Maybe gardening, having a few plants in your room. Maybe painting. Maybe just singing on your way to the hospital. Just put your earphones on Sing. Who cares? By far, the people will say that, I saw that doctor singing on the road on his way to the hospital. Now, talking about social resources, as I already said, it is about having meaningful relationships rather than having these transient little relationships. Connections, yes, definitely they're important, but having more meaningful relationships, people with whom you can at least have lunch in silence, that itself is going to be calming. That itself is going to be soothing. They give you your own space, and for taking that, you also have to become like that, where these few people, they can share a mutually safe space, they can be with each other, and they can experience certain degrees of calmness, certain degrees of relaxation, so that they can build on what is going to come next. Academic resource, again, it all goes in the loop. Talk to your peers, talk to your mentors, have fruitful discussions. I'm sure you have case conceptualizations and case discussions in your academic settings, right? Make use of them. Don't just think that it's just an activity that we have to do. A lot of your experience will come from this discussion, from these debates. And this is where we truly grow, because as it is, we are reading books. Which brings us to the next point of why the color yellow. Yellow color is the color of binding, it's the color of cementing. Okay. And so, how can you know that you're doing the right job? So, there has to be a yearning for purpose and balance. Balance and value, these words are related. So, where do you have to allocate your balance? Where do you have to allocate this value to life? So, not only studies, but training of a lifestyle. Often, many times, as I said, I was a professor for past 2.5 years now. And then these students used to come up and say that, sir, studies are so difficult. No, we are not training you only for studies, but probably for a lifestyle that you're going to experience all throughout your life from now on. I was a student of one of the most reputed universities in the country. And we had a saying that if a person can survive this, they can survive anything in life. That was the attitude that we had as a class. And all our peers, we were all together in it. We supported each other, and now when we are through the university almost 5 years now, all of us are still connected. And whenever, in whatever conference, webinar, or whatever down the road we meet, we smile and we know that that was true, that if we survive this, we'll survive anything in life. So this is about having a right attitude, that you're not only being trained in a particular academic discipline, but you're being trained for a lifestyle. So there are certain things that you'll have to change. And now is the right time to experiment with those lifestyle, not with the patients, not with your academics, but with these lifestyle changes that you need to bring. And what becomes another point of resistance are these vicious cycles. Vicious cycles like, oh, I'm too disconnected from the society. Let me just use some social media. No, it's not going to help you. Watching news may help, okay, to know what is happening around the world. I'm saying by far, watch Animal Planet. That's still easy. That is still better. Still better. I'm telling you honestly. With my clients, I've used this. So these vicious cycles, these are the misguided attempts that we think that help us, but they don't. We may go to our friends and talk about a hard day at work, and we may go on ranting about it, but you're still at work if you're ranting about it. Yes, sounds a little uh, difficult and sounds a little absurd, but yes, that is truly the fact. So when you are in your safe space, why do you want to still go and talk about the things that you've done throughout the day? What about those things that you can do now? So this is what is called by having a progressive mindset, having the proper mindset that, okay, 12 years of 12 hours of duty, what am I going to do for myself now? And then it brings us to the point of resource management and balance allocation. How much value am I going to allocate to what aspect of my life? I may be allocating cognitive effort I may be allocating, all my energy to treating my patients, to my academics, how much value should I give? How much emotional value should I give to them? Often, many a times, students come with this complaint that, teachers shouted at me, my professors shouted at me, they were this and that. The basic principle of education or of any academic discipline is that you must learn to keep your emotions aside. Because whatever resources they are, our mentors, our teachers, our professors, they are also human. It is very natural for them to have a certain reaction. But if you keep sticking, if you keep investing your emotional balance to it, first, you will not be able to take it as a feedback. A construct, it's about communication, right? Communication involves three things: the person who's sending the message, the content, and the receiver. So the content is going to, no matter how the content is, it is upon you and on how you take it. So even if it is a constructive criticism, if it's a constructive feedback, and if you do not have a right attitude, it's going to come as an attack. And if you have the right attitude, even an attack will be perceived as a constructive criticism. So it's about allocating the right kind of value to the particular aspect of life. And then easier said than done, which is emotional regulation. So yes, at the end of the day, because there is no end to the day, you have to reflect on what you experienced and then try to manage it. Because this is what is going to result in habit formation. If you get into a habit of having a retaliative attitude, almost always aggressive, maybe things will not work your way. Even when the things are right, even when the things are favorable, you will have some or the other doubt that, it might go wrong in some way. And this is why balancing is important. That even though you're on emergency checks, you have to relax. You can relax. That will only come with certain degrees of confidence, and that confidence will come with competence. It will not build in one day, but it will build one day. Rome was not built in a day, right? But we see Rome, it's built one day. So all the processes, they will happen gradually. All we have to do is be consistent. Consistency is the key. We have to have faith on our own efforts and have the right attitude towards our own efforts. Which brings us to the point, to the color orange. A little more technical part of balancing life, which is optimizing daily life functioning. Do not skip meals. Doctors should not skip meals. People are relying on you. You need the most energy. Do not skip meals. Stay hydrated and do not skip meals. Do not rely on caffeine for keeping you awake. Once you develop the right attitude, you will be active and not aroused. You do not need arousal, you need activity. And second is, you need to optimize organizing. Delegate work sometimes. If you can't do it, delegate. Workload distribution is one of the most important management in healthcare management systems. Even though management systems can be understaffed, but there should be some way to regulate it. And now, which brings us to a more important point of optimizing learning, is if you sit at towards the end, as we were discussing, right? Some people said that they work better under stress. If you get into a habit of it, you will always be under stress. Life is an examination almost every day, especially when you're dealing with critical cases. So learn to optimize learning. Have those little snippets of learning, maybe on your way to the hospital when you're in the bus, or somewhere when you're seeing a client. Quickly open your books, quickly open your material, talk to your mentors, and complete that segment of learning then and there. Helps it. Integrate the application part and the theoretical part. It will help you. And this is how you solve problems also. So problem solving, not only for your clients, not only for your patients, not only at academics, but for your own self. How do you navigate through problems of life? As we grow old, life should become simpler. And then optimizing Pomodoro. What is this Pomodoro technique? It's been all over the internet for a few years now. So it's like 15 minutes of working, then 5 minutes of break, then 15 minutes of working, 5 minutes of break. Learn to rejuvenate your body in this shorter breaks. Again, do a breathing exercise. Taking the small break of 2 minutes, 3 minutes between two patients. Yes, you will not get sleep, but you will relax. So, Pomodoro not only in your academics, but in your daily life as well. If you value your time is going to value you. Others will also value your time. Which brings us to the last color, which is red. Yes, red color is the color of compassion. It's the color of love, right? Again, I was in a spiritual meeting when they said that we can distribute all the elements of blood from 1 liter of blood. But if we combine those elements, we cannot form blood again. I'm not sure. I don't think anyone can make blood till now. At least not in the scientific world. It has not been revealed that way. So what is that makes it different? It is this resilience. It is the humanity in us. We have to build our resilience. Resilience not only in terms of skills, but at trait level as well. Building these character strengths that help us. Being ethical at work, being punctual. Once I know that I have to be at hospital at 9 o'clock, I have to regulate other things around it. It makes life more easier for me. So instead of complaining that, you know what, I have to be at work at 8 o'clock every day, it's easier for me to process that, okay, I have to be at 8 o'clock. So everything else has to revolve around it. Again, depending, choose your own priorities, but be sure about them. Communicate it to other people so that they can know how reliable you are, on what points they can rely on you, and on what points do they hold you accountable for your actions. Having a positive mindset is really important, and mindfulness, being in the here and now. As I with these different snippets, I've already been discussing that we have to be in the here and now. So when I'm with my family, I'm going to be with my family. When I'm with the patient, I'm going to be with the patient. And it's not required to carry forward this burden here and there. And finally, as Dr. Khatia and all my fellow speakers said, ask for help, both formal and informal, before this gets out of hand. Seek professional help. If and when required, do seek it. Asking for help at the right time is also itself a sign of courage, a sign of resilience. As I said, we are all still humans and we can only do this much. We all need some degrees of social support, some degrees of help from others so that we can sustain in the best possible manner. So, with this, I think I can rest. I think I could do justice to the topic. Yes.
Thank you very much, Mr. Abhishek, for those amazing and thought-provoking lessons that you highlighted today. From all the way from how to manage with stress when it comes to uh, how to manage stress with using the rainbow method, like you highlighted and explained elaboratively throughout, to everything else and all the key details that you shared with us. Uh, Now we would like to open up yet again the podium to the audience members if they can raise any doubts or questions regarding whatever doctor has highlighted.
And did it go too heavy? I don't see anyone raising any questions. I'm sorry if it was too heavy.
Doctor, just to correct that, you didn't go too heavy. You went perfectly fine and elaborate. That's why they don't have any questions.
to the
Yeah, no,
doctor.
I had no questions. I was just about to say what Iman said. Like, you've perfectly explained a lot of things which were on our minds. So I feel like everything has been very clear for us. Thank you for that amazing presentation.
Thank you. Thank you for having me. Shabir Al-Bashik has a question. Can we take that?
Yes.
Yes, hello. It's not actually a question. It's just I want to share that it's my first time entering or having an experience like this, entering through a very formal, very perfect, very organized event like this. I was actually at first I was a bit skeptical, but then I was mind blown by all this work, all of these people, all of these doctors, and I'm very astonished by you, Dr. Al-Bashik, by Dr. Khatia, by everyone who put a lot of work into this event. So hopefully in the upcoming events, I'll try to gather all this information. I'll try to implement them in my real life because I am kind of dealing with some type of stress and anxiety, and I'll try to implement your techniques and other doctor techniques into my everyday life, and hopefully it will be good. Also, I want to mention that the presentation was so perfect. The design team did a very good job. The social media team, everybody did a good job, and I'm just very excited for this.
Yeah, I don't think so. The audience have much of a question to raise because, like like everyone before mentioned, Mr. Abhishek clearly highlighted everything. Before I conclude things formally and officially, I would like to invite Eman, the Senator of Dundee TSMU, because she has some remarks and insights to share.
Thank you so much, Shabir. And this was definitely one of the most insightful webinars I've ever attended, because not only have I sat for the entire webinar and listened to every single question and statement by every doctor, I've also learned a lot as someone who is a final year medical student, and not only dealing with the stress of medical life, but also what's after medical school. So thank you so much, doctors. This was absolutely phenomenal, and we would definitely love to have you all again. I would like to take a minute as well to recognize my team, because I don't know if you guys know, but as Dundee TSMU, this is the first webinar we ever conduct as a team. And I am definitely sure that this was a successful webinar. I hope that everyone who attended agrees. So I would like to, first of all, thank the speakers. I don't know if you know their names, aside from the doctors, but also the speakers or the presenters themselves, Atroba, Mancho, and Shabir, alongside these beautiful presentations that you have seen done by the designing team, led by Namarik, and all the feedback forms that you're going to give filling done by Maria, and the PR and outreach also did an amazing job finding these amazing doctors and inviting them as well to our meeting, led by Muntaha, and also PR by Shaina. So everyone contributed greatly to this, and I'm extremely proud of everyone, especially my team. And I would love if you guys fill the feedback form with your honest feedback, because we take criticism properly. And as Mr. Abhishek mentioned, that not everything is a criticism. Sometimes if we have the positive attitude, we can take things as, even if it's something negative, we can take it as a positive feedback, or we can view it positively as something to improve ourselves. So please, if you have any remarks or doubts or criticisms for us, please do write them in the feedback form. Thank you so much all for your time, and I'll